And glad everyone can make it now. Here we go. All right, just a regular afternoon here. Hello, Connor. Professor Wild, I think you're here now.
I am. I apologize. I had a bit of trouble connecting.
Oh, absolutely no trouble at all. Nice to see you. Oh, look, you're outside. We should all be outside. It's raining here in Charleston right now. First off, we're gonna have to talk for a second, and we're gonna get off and running. But this is one of the great things of the pandemic, is that we can get connected. Our school dismissed early so that we could go home because it's a little bit after 4 o'clock. Our school day's over, and so we've then reconvened here, and we've never met. We've just corresponded by email, and Jude, Professor McCool, another member of the Population Health Department at the University of Auckland, connected us together. And you and I need to talk about e-bikes later too, because the kids know I ride an e-bike to school, and I know that's a research interest of yours. But we just wanted to thank you. This is a real joy to be here, and I wanted to ask you, would it be okay if I record this to share with some people who are not here today? And sure. This is your hour. And then we've got some questions if time comes to it. And we just are so immensely grateful for you joining with us today and being willing to take a chance on a school in America that wanted to talk to you about New Zealand. And, you know, we're two entities that have about the same number of people, 5 million people in New Zealand, 5 million in South Carolina. We've got 4,000 deaths, and we've got, you know, schools shut down and craziness, and just wanted to see what we could learn from talking with you. So again, Professor Kirsty Wild from the University of Auckland Population Health Department, many thanks, and I'm turning it over to you.
Thank you so much, Jason, and good morning to, or good afternoon to all of you over there. So nice to get a chance to talk to you, and I'm so looking forward to hearing from you all as well about what life's like for you at the moment. I know it's been a really big year for my little boy. And this is our first big pandemic for me as a researcher, trying to figure out what's going on. And obviously as a mum, just as a human being, this is obviously a pretty big deal. I know you'll probably spend the whole time thinking, wow, she talks really weird, because that's what I remember noticing when I talk to people over the other side of the world. But you're right, Jason, we have some similarities, although our whole country has about 5 million people, so we're pretty small. And I'm going to talk a little bit about what's happening with us, with COVID, and my son, and our community. And then I just want to talk together about your ideas about how we can get through this too. So I'm going to share a brief PowerPoint about New Zealand and our experience with COVID. Right. Okay, can you see that? So COVID in Aotearoa, that's what we call New Zealand, and the indigenous name for New Zealand. I don't know if you've heard that name before. But we're starting to use our indigenous name more. This is a world map with New Zealand at the center of it, so it looks a bit different. You can see North America up in your left or right, I'm not sure, and New Zealand's right here in the middle, right next to Antarctica. So we're pretty small down at the bottom of the world, and in some ways that's a bit of an advantage for us because we're an island nation, so we can control our borders when it comes to COVID. Right, a bit about us. I'm just going to minimize that so I can see. Aotearoa, we've got a population of about 5 million people. When I think about comparing us, I always find it really interesting thinking about the other English-speaking countries. You know, we're like the US, Australia, the UK, how we similar, Canada, how we different. Aotearoa settled quite late, both by our indigenous people and by Pākehā or European people like me. Māori were the Great Pacific navigators. I don't know if any of you have seen Moana, but and they arrived here about 2,000 years ago, and Māori are nearly a fifth of our population. We have a special relationship with our Indigenous people, and they're really important to us. Pākehā like me, white people have only been here for about less than 200 years. So we're a little bit different to the US in that way. And that's one of the big reasons why we moved really fast with COVID to lock down and to try and stop the spread of it, is that in our last big pandemic, Māori were 8 times more likely to die of influenza. This is an old photo from the 1918 flu. Some people have long memories and they can remember what happened with our Indigenous population last time, is that this is a hospital, a Māori influenza hospital. And so our Prime Minister decided we don't want to see that again in New Zealand. We don't want to see our Indigenous population devastated. So you will probably know that in lots of ways so far we've had quite a bit of success with COVID. So we've had nearly 2,000 cases. We've had 25 deaths. We had that a spike earlier on in March and April when everyone else was experiencing it. We locked down and we've managed to pretty much keep it out. We have cases at our borders with people in isolation, but we don't really have it in our community. So we've had about we have about 292 cases per million, and I think the global average is nearly 6,000 per million. So far we're doing pretty well. And I think there were some reasons for that. Our Prime Minister was really quick to act, to say, no, we don't want mass deaths here, and our Indigenous population is particularly vulnerable. Scientists early on had a bit of an aha moment with COVID, and they realized that we had lots of plans to deal with flu, with influenza, but flu's a bit different. Flu, you get infected and then you become infectious quite quickly. It's hard to stop it spreading, but they kind of realized pretty quickly that COVID's a little bit different. There's a bit of a gap between when you get infected and when you become infectious. We're still finding out more. But they realized, hey, hang on, we might actually be able to break the chain of transmission here. Maybe we don't need to have it at all, you know, till we get a vaccine. So there was a commitment to a strategy of elimination, which means that we try and keep it out, and when we have cases we quickly try and isolate people and stamp it out. So elimination means we just don't have it circulating around in the community. We still get cases at our borders. Scientists have been really valued here, which it's been good. We still have fights between us about things. Some scientists don't like the lockdowns. They worry about the economic effects. They worry about the health effects of lockdowns. But generally, scientists have been really valued in our COVID response. Our Prime Minister has been really good at creating a sense that we're all in it together. The messaging, let's come together. We're a team of 5 million. And I think our Director General of Health, so he's our sort of chief scientist for health, he put it really well when he said, people like to be kept safe and feel looked after, and the government's really the only institution that can do that. So in our Aotearoa, we've had a strong message from our Prime Minister, you know, who's like our president. We have a slightly different system, but and our head of our health department, that we're all in it together, and that science is really important. Let's join together, let's trust the science. And I think someone described it as New Zealand having a sort of winning combination of science and empathy, and I think that's true. These are our two leaders, Jacinda Ardern, our Prime Minister, and Ashley Bloomfield, who I just quoted about people valuing the government looking after them in times of stress and crisis. You'll have to excuse me, I've got a terrible cold, and I had my first COVID test this week. Luckily it was negative. But yeah, I'm a bit sniffly. Yeah, so in our first lockdown, everywhere we went, we saw lots of messages about being kind as well as staying safe, looking after each other. The Prime Minister described let's stay together in our bubbles. That was a word that other people have used other places. So it meant, you know, our precious little family groups, our bubbles. Let's stay together, let's stay safe, let's be kind to each other. And I think that really, that message from the government was something that we also saw when the government sends out a message that people value. We see that picked up by businesses, we see that picked up by communities, and I think we really saw that in New Zealand. When you went out in our first lockdown, there wasn't so many ads. Lots of the companies replaced their normal ads with you know, messages of thanks to the farmers, to the nurses, to the essential workers. Everywhere we went, we saw lots of messages like that. When you went out on the street, you saw lots of chalk messages, and I'm sure that you guys have seen those same things here, just to other people saying we're here. It was actually the first lockdown in particular, there were lots of really lovely things about it in terms of feeling like we were pulling together for something tough, but we were in it together. We had this great thing called the Big Bear Hunt, where everyone put bears in their windows so that when we went out in our bubbles for our walks during lockdown, kids had things to look for. So here's my son Arlo, who's 9. We're out looking for bears. This was a particularly cool window that we found. This woman must have been so excited. She had so many bears. And she was like, yay, it's my moment. I'm going to put all my bears in the window. Yeah, so that was lovely. There were lots of what I would call, I'm a social scientist, and I would call it lots of pro-social messages and sentiment. People were sending each other lots of messages that they cared and they were looking out for each other. And so I guess for me, I work in environments and health. So I'm really interested in now how we can make safe the new normal. It's tough. Lockdowns get tougher. Populations are not so keen on them often. It's tough. They're tough. And throughout history, we've had lots of pandemics, and almost always we've had to change our cities to cope with them. So when we had cholera in cities in history, we had to think about how to make our cities cleaner, to put in sewage pipes. When TB was a big issue, we had to think about how to get outdoors more. Our cities have almost always needed to adapt. So I'm an urban health researcher, and I'm really interested now in how we can move forward for the next few years, which it will probably take us to get things totally under control, and how we can learn from each other all around the world about how we can have good lives and happy lives and safe lives. So and that safe just becomes the new normal, and we don't have to think about it all the time. And this is a lovely picture from my local church, where they're just trying to make, you know, the 2 meters the norm. This is another nice picture from our first lockdown with kids biking, and I don't know if you've had that experience, but it was, our first lockdown was amazing in terms of there's much less traffic, so families were out together walking and biking. And so now I'm really interested in how we can learn from each other all around the world about how we can create new environments that are safer and also really enjoyable. Like, how do we make bike lanes in our cities so that people can get outside more and use safer open air forms of transport. Here's a school in Denmark actually where they're like, we're going to try and spend as much time outdoors as we can, so we're going to bike more and we're going to go to the forest more. And I know in Asia they're doing that more classrooms outside as well. How can we spend more time outside? There might be lots of good things about that too, you know, for our health in general. So how can we have good lives for the next few years and keep each other safe and all around the world learn from each other? We're all still learning as scientists about what we need to do. Yeah, how we can look after each other together. So that's what I had to say about the New Zealand experience, and that's probably not quite half an hour, Jason, but I'm very keen to hear from you guys about what things are like over there too.
Wow, that was beautiful, and loved you sharing your personal stories about your son too, and some of the similarities. The kids will definitely weigh in with their questions and thoughts too. So do you want to, I'm going to give you the quick 90-second update on us.
Sure.
So
I'm going to mute myself while I blow my nose and listen to you.
Absolutely. So, you know, America is a diverse, rich, vibrant country. And one of the things we've been making sure our students learn about is the pandemic's given us the opportunity to look at things that maybe we don't look as closely at. And our governmental system is federalism. So we have national government and we have state government and county government and local government. And so Americans enjoy that because it enables you to stay connected in a lot of ways to the people that you elect and make decisions locally. In a pandemic, it means this, you know, when it comes to making sense and making decisions. And so it's been very hard. And as educators, we feel for all the students in America because the pandemic has not gone very well here at all. And it's sad. And yesterday, when we were talking about this, I'm sure you're aware of this, America had this rating of being one of the top countries prepared for a pandemic, and it just hasn't gone so well. So a cool thing is the students are all about 4 o'clock meeting with a population health professor at New Zealand. We can do that because they are charged up and everyone wants to learn and hear about it. So we locked down for about 7 weeks in the spring, and then everything's just sort of gradually reopened since then. And again, it's federalism. So different states, different municipalities, different things. South Carolina, fortunately, is fairly stable with a, you know, I think we're in the middle of the 50 states as far as rates of spread and stuff like that. And we're lucky that a huge teaching hospital, the Medical University of South Carolina, is where we're located, and it's provided sort of a educational shield for a lot of us. But there's great disparities in the way you know, COVID's impacting Native Americans in our country, and in a way it's impacting people who don't have a lot of resources or are poor. And so for us, we had to lobby our state government to get permission to put tents up because it wasn't legal to do that. That only happened a couple of months ago. We're trying to get our schools to be seen that you can have school outside. It's really seen as virtual or in a building, and and so we're working on that. And we're connected to some schools that we've been friends with for a long time that are poor resourced, and we've done 33 weeks of gathering books, toys, and food and carrying them to these families because we've I think the wealthiest Americans are doing great, and the poorest Americans are doing absolutely horribly. And then there's a large middle income mix. And so that's sort of what it looks like. And just, I worry about the kids thinking that this is the way it is. And it's important to see the way it can be other places, and to be able to, for you to spend some time with us. Again, I cannot ever thank you enough because your presentation was cheery. And we've done a little work, and I think it's eye-opening for the students to know that, you know, we're not the same as New Zealand, but that there are different outcomes and that there's things to be learned from each other. So thank you. Yes, grateful.
Thank you. Yeah, and I am aware that doing a cheery presentation, I don't, you know, I don't want you to feel worse about your scenario, because I am aware how tough it is. But I think this is a time, you know, we've done pretty well so far, but honestly, at any moment, you know, we could have a big outbreak, because it's a really tricky virus. And this is a time for us all to come together all around the world to figure out what works, to create a new normal that is, you know, safer, and we can still have a good life. So I'm very grateful. I am very inspired by a lot of things that are happening in the US in terms of you know, moving dining outdoors, or in terms of being an urban health researcher. Lots of areas where they're doing cool things with transport. Yeah, and just even the history of the US and how you dealt with the flu pandemic, you know, the 1918 one, in terms of outdoor schooling, all sorts of interesting stuff. So we look to the US too for lessons, because we all have stuff to learn from each other. Because you'll know that COVID gets called a novel. It gets called novel coronavirus. So and that's because in the last 30 years we've started to see all these new diseases, pretty much, that come from animals, and they're all new to us as scientists. We don't really know how they're going to behave. So there's heaps for us to learn from each other, yeah, about how to deal with novel viruses.
Yeah, I appreciate that. And I'm gonna ask one more question, and then I'm gonna start having the students ask their questions. Communication piece has been kind of interesting, because we collectively, we hear a lot of different messages. And I know that New Zealand's done a really good job of staying on message and having a very clear and concise form. But within the larger public health and population health community, we've been operating, I tell the teachers and students this, we're operating like we'll be operating the way we are now next year too. And that's a terrible thing to think about, that it will be a couple more years. But I heard you say clearly that you're expecting, and are your peers pretty much thinking that it's going to be at least a few more years like this?
Yeah, I mean, it's hard to talk about, isn't it? Because that does seem a little bit tough to think about. So it's yeah, yes, I think a couple of years. I think it will take a few years for us to get to the point where the vaccine is really widespread, and that we've, you know, I mean, we will probably have seasonal outbreaks for a few years. I mean, based on the modeling from Harvard, yeah, they talk about 2024.
I consider myself well-read, and I have not heard 2024 before in any official capacity. So I'm saying it's a benefit of talking to you, to get an outsider's perspective informed about that, and for the students too, to just sort of get insight about that.
But, you know, we will get better at dealing with it.
Yeah.
Doesn't mean it's going to be like this. It means we will figure out, and as I say, pretty much all cities and communities have had to adapt. And so many good things have come out of those adaptations too. We've made cleaner, healthier cities, for instance. You know, there'll be lots of things that we can do to cope with COVID that will help us deal with climate change. You know, we can make sure that good things come out of this as well. And I know that that's tough to talk about. It might take a couple of years, but it might take a couple of years. Yeah.
Yeah. Well, I know that if you and Professor McCool abide by this, I'm certainly intend to be in touch about what you were saying about adaptations for living healthy and safe lives. I mean, that's our school's premise, is we're trying to make sure that we're creating options so that we can function in a way that we can have school, have fun, learn, and be safe. And so you'll be hearing from me.
I don't know whether you have anything you want to add, Jude.
Oh, look, I want to say I'm sorry I'm a little late this morning, but I really enjoyed hearing what you had to say, Kirsty. It totally, it makes good sense. I think you've framed how New Zealand has responded, and in a way how we're all going to have to respond globally going forward. But I think I work in a slightly different area than Kirsty. So I work in an area called global health. So I'm interested in population health strategies that are relevant to New Zealand, but my own work also extends to the Pacific Islands region. So I spend a lot of time working with colleagues across the 22 islands, countries and territories in the Pacific region. And one of the things I take heart from in terms of this current situation is that we are coordinating a whole lot better than we ever did before. So I think those kind of perverse or the not top of your head thinking of the benefits of the situation really come together. So I think we can see that data, information about what works well, what doesn't, how to adapt is being shared in a way that we haven't seen before. And I think that's really promising. And that is the only way we're going to get through these and other pandemics or issues that crop up in the future. Another thing that I think we've learned, and it's a hard one to learn, because as society progresses, we think of technology as the future and sophisticated systems as being in hospital systems, you know, being the way of the future. So I remember a study some years ago that was conducted a few years ago, and it looked at all the countries that were going to do really well if an influenza pandemic came out again. And what they found was the countries that were expected to do well are actually the countries who haven't done well, because they based it on the countries with the high sort of access to technology and hospitals. Unfortunately, but yet fortunately, the simple measures are the things that are working really well. So things that are tough, that you can't just turn a switch on and it's going to make you get better, or a vaccine is going to be easily available in your local pharmacy, but relying on things like social distancing, wearing masks, basic hand washing, things that we know, like public health 101, as we call it, really is the kind of measures. No matter where you look in the world, they have made the difference. It isn't your access to a ventilator. I mean, ideally, we don't want people on ventilators, because when they're on a ventilator, they're really sick, and most hospitals, even the most well-resourced hospitals, we just don't have enough typically. And so what we want to do is, as in public health, is shift the focus up to the things that drive why people get sick and how we can prevent that. So we've learned a lot. And unfortunately for people who are really loving, exciting, you know, there's certainly a lot of work going on in vaccine development. There's a lot of work going on in our university and labs, designing and trying to refine you know, the genome that's kind of associated with the vaccine that's going to help people not get COVID-19. But most of the big efforts are, how can we share data? How can we track and trace people really quickly? How can we isolate the virus and work towards sort of containing it? Kind of really, really clever, but really simple stuff that requires quite a few people on the ground though. So this is where for New Zealand, we've realised that yes, we have done well, but yes, it also could rise up again. But we need to put lots of more people and a lot more effort into public health. And that's just not doctors and nurses, that's people who are involved in contacting people, who are involved in developing really neat communications to remind all populations that they need to do these things, not just people who look like us, but other people, people who are in more isolated or vulnerable communities. So I totally agree with Kirsty. We have learned so much, and we haven't done things perfectly here in New Zealand. Yes, we've got low numbers, and yes, we're a smaller population. We've got an island, we can, and we've implemented a really consistent, trustworthy campaign, and it's serving us well. And I think it's certainly a whole lot more complicated, Jason, in the US in terms of the complex systems you're working with. I mean, how do you get that coordination and continuity across everyone. Big ask. So I echo what Kirsty said also. The US has done some and trialing some fantastic innovations, and there are pockets of, of real resilience and success as well. And I just think we've got to keep looking around, looking up and out. What is happening elsewhere? How can we learn from that? And keep that optimism up, because it will change. Nothing stays the same. But I would love to hear some questions, as Kirsty would, I'm sure, from this group of students we can see there. So hopefully they feel comfortable to throw questions at us.
Yeah, and I'm gonna mediate this, and I'm gonna call it, because I'm just gonna sort of bounce out. But Professor McCool, thank you so much. Again, at the outset I was saying, like, hi, here's this person from a school in South Carolina emailing y'all, and I just am grateful that you took a leap of faith to work,
Right.
have this moment together, and hopefully it'll be worth your time, because we're very grateful to you.
No, it's wonderful. It's a pleasure to be here, Jason. Really, it's great.
Oh, good. Well, thank you. I told the kids I actually went through the Ministry of Health first, and they could not have been politer in saying no. they were like,
just go straight to the.
We're terribly sorry, but it's very busy here, and we won't be able to help you. And I was like, you make me feel good about saying no, that's fine. So I'll try it otherwise.
It's good.
So it's good. So, all right, here we go. Some questions from students. Ronan, this is one of our high school students. Ronan, I think you're here. It's up to you now. They're going to unmute, ask their question, then they're going to mute themselves back up again.
Yeah, sorry, hold on. I actually have it on a document. Let me pull it up real quick.
Sounds like it's going to be a complex question, Kirsty.
Okay. Thank you for coming to start. My name is Ronan. I'm a 10th grader at the university school. In terms of New Zealand's response to COVID-19, what was the most crucial step in keeping your cases down? And do you think that this could be applicable to other countries? Sorry, I'll go a little more into depth. New Zealand is obviously an island nation, so you don't have to worry about like people coming in from borders, which is a difference that you have with a state like South Carolina, which is the same population, but we have people all around us. So I was asking whether your response could be applicable to a nation that has borders shared with other countries.
Well, that's a great question. Kirsty, I'm going to lead off on that.
Yes, I mean, we still have borders, that's where we have our cases coming in from. But we have everyone pretty solidly quarantined, although our latest outbreak is from a port. Ports are tricky for us now. I think, yes, I think we see countries, and I think it is absolutely harder. I think that our success probably came from locking down pretty fast until we could get contact tracing capacity up, and sorted. And I can't say that, I mean, it just isn't as easy, but, you'll need to get some coordination between all your states all at once, probably, to get things sorted. And that's a challenge, isn't it? We don't have that challenge. I don't know if you have more to add to that, Jude. Oh, you're muted.
Yeah, I think that's a good point. I think the thing what New Zealand did that was probably a little bit distinctive, actually, Ronan, was the fact that, and the term was fast, we locked down fast and early. So when other countries are thinking, is this a problem? What do we need to do here? I think the benefit of not just of a smaller country is that you have very close connection between the scientists in universities and the government. So that rather than multiple layers and lots of bureaucracy, you can have some of the very top epidemiologists. So people are really mapping the movement of disease and outbreaks communicating directly with the government. And so you can mobilize and get people talking together in one room very quickly that you can't do in much larger countries. So we have a number of very experienced epidemiologists who were able to come together very quickly and talk with our government. A small group of people came together and they could make decisions based on the best science at the time. So rather than worrying about what it was going to do to industry and the economy immediately, they were concerned about that. The immediate concern was public health. Let's keep our population safe. Let's make decisions based on the best evidence we can get our hands on. And maybe we have to do things a little bit different than the rest of the world. So the WHO was just a little bit slower in announcing this was a public health emergency of international concern, where you are required to report on all the cases that you're getting in the country. So New Zealand went fast, we went slightly earlier, and we had a really good smallish team of really top-notch scientists who had the ear of the leader of Dr. Ashley Bloomfield and Jacinda Ardern. So that makes things a whole lot simpler. Work with people you trust, rely on good science, make decisions, even if they feel like they're a little bit different than what others are doing. But if you're confident that it's the right move for your country, thank goodness you've got good leadership to make those tough decisions. So that's probably a little bit unique about New Zealand, I think.
Thank you so much. Oh, sorry. I did not mean to cut you off.
Oh no, I should just say I guess that you're asking that in terms of, you know, what can you guys do and is it going to be possible for you guys? And I absolutely have faith in that. You know, you're the wealthiest country in the world. You have incredible scientists. You know, you do have an ability to pull together, and that's your challenge now.
Thank you.
All right. Thanks, Ronan. Our next question is from Meredith. She's one of our middle school students.
Hello, thank you for coming. So you guys are taking this, like, you're going fast, you're doing a lot of precautions. Are there any people who are being like rogues and they're just like completely not, like they're completely ignoring all these rules and they're just causing trouble?
I'm not sure if y'all were able to get that or not. I'm sorry about that. I'm going to back it up. She had a question. Yeah, it's okay, Meredith. I'm going to have to share this. She was wondering about if there was people not sort of complying with the expectations in New Zealand, if that was causing some issues there. Sorry about that, Meredith. You just have a connection issue.
Great question, Meredith. I'm sure Kirsty will have some things to say about this as well, but you will always get a proportion of a population who's going to go, actually, this is not for me. I don't believe in this. I'm going to do things my way or our way if they're a part of a group. So yes, we do have that. We have a small group of scientists, even in our university, who I guess, presenting a case that New Zealand shouldn't lock down and that we should try to aim for herd immunity like they tried in Sweden. And so perhaps New Zealand should relax its restrictions and allow the virus to come into the country to do what it does, which is infect people with comorbidity, who are already older or unwell. So yeah, we do have people, and Meredith, it's a really tricky issue to deal with. And I think it goes back to just having that consistent and then backing it up. Why are we doing the things we're doing as a country? And yes, we know there's going to be costs, because when you shut things down, people don't go out, and the economic impacts are really significant here. People are really hurting in New Zealand. It's not like we've sort of got away with it. but it's that trying to convey as clearly as possible the balance, the positives of locking down, or to encouraging people to wear face masks, or whatever the strategy is, against the costs, the risks to personal freedoms or economic well-being of a country. So you're always going to have that, Meredith. It's one of those really difficult things in complex societies where we have, you know, a right to have different views and to be heard. But Kirsty, you might want to add here.
Yes, thank you for that question, Meredith. I don't think I thanked you, Ronan, too, for your question. But I think perhaps we haven't had quite so much of it here, not yet, as you've had in the US. But Jude's right; it's always a challenge. I think that the Prime Minister really tried to emphasise that we're all in this together. Really tried to, you know, work hard to make us feel like that we're part of a team. And when we feel part of a team, we're less likely to do that, because we want to look after our team. And I think that has been a great thing here, and it has reduced that, people feeling like, you know, oh, I'm just not going to wear a mask, or I'm just not going to, but it's still an issue for us, you know. And I think that's one of the reasons why I am quite keen for us to think about how we can just make things safer in general, you know, get more stuff outdoors, get more, so that, you know, life, we just have a new normal, and we don't have people feeling so restricted all the time, and they don't have to do stuff that they really hate, you know, because it's hard. It is hard to do things for a long time that are unpleasant. You know, we know in population health that that's difficult to get people to do unpleasant things for long periods of time. Yeah, just trying to focus on how we can support community resilience too, like economic support for our businesses, economic support for our communities, so that they don't feel like life is too hard. They don't feel like the sacrifices are too much.
Thanks, Meredith. Our next question is James Oliver. He's one of our younger students. James, we're struggling here. Why don't you type your question into a chat, and then I'm going to move on, okay? We'll do that. Our next question is for Connor. He's one of our older students.
Hello, thank you very much for coming to speak to us today. I have it written down as well. I was wondering how you would believe that an effective protocol could be established in a case where we may not be able to have access to some items such as masks or kind of antimicrobials in an area that might not have as many resources in the case of an outbreak continuing into the future?
Connor, so just to clarify your question, so how do you establish a protocol for kind of the ensuring even the most sort of essential sort of services or equipment, etc., available for people during pandemics? Is that the question?
Yes, ma'am. I guess kind of how you can try to make those, yes.
I think it's a really good question, Connor, because one of the things that we're learning from this current pandemic is, goodness, we thought we were super prepared. We were filling in the boxes. we were ticking all the sheets and checklists that we were all ready to go should an influenza pandemic. Well, it caught us all by surprise, and we didn't quite have the things that we needed. We didn't have quite enough personal protective equipment in the hospitals available when we needed it, right on site. So I think your question is absolutely spot on, and it's the big challenge at the moment in the in the World Health Organization and other big global health organizations, is to try and figure out and predict what do we need, what is the minimum we need to get by as a country when these things happen. And the protocol you mentioned is exactly what they're working on, an updated pandemic preparedness plan that is relevant for every country, so it has to be adapted. You can't have one plan that fits every country in the world, because we've all got different, population needs, etc. So this is really a focus of a huge amount of work. And actually, our former Prime Minister, Helen Clark, is working with the WHO at the moment, with some colleagues from Auckland University on preparing these protocols to try and think and put all the thought into what do countries need should these things happen, because we're all aware that we weren't quite as well prepared as we thought we were. So, you're right on the money with that one. It's absolutely one of the biggest questions. Thank you, Connor.
Thank you very much.
Yeah, thanks. I probably don't have much to add, except for, we need to treat these things like they're human rights too, so that in every community, everyone has, we have universal health care here, so everyone has free access to the health equipment and supplies that they need in a pandemic as much as possible.
Thank you.
I just had one more point, Connor, actually, for your question. That's, I had a student that was working with me and actually another colleague over during the early part of the lockdown, looking at panic buying, in particular, the sudden shortage of flour in our supermarkets. For some reason, everyone decided they were going to bake, and I'm sure it's similar in the US and other countries. So what we had was this kind of panic response, essentially, that the very normal human response to a threat is to hunker down and gather all your toilet paper and your flour and all the things that you think you're going to need. We probably learned a lot from that actually we probably need to communicate better that shop normally, because supplies will continue coming through. But we probably do need to think not just about medical and health preparedness, but how do we enable populations to just continue to get access to everyday resources so they don't think they're going to run out and then cause bedlam down at the supermarket. So we can probably communicate better around that and provide better reassurance. I think we've got a lot of a lot of learning around that example. And I think it was a global phenomenon, the flour and the toilet paper shopping. It was one of the notable features, unfortunately, but shouldn't happen. There is enough resource. We're awash with toilet paper and flour, I think.
Thank you for the insight.
We'll be continuing that discussion tomorrow at school. That's going to be, I'm all over supply chains and everything. That's neat about the shared experiences about baking. Thanks, Connor. This next question is for Kalia. And going forward, if we have any technical difficulties, I've got a couple questions that were pre-written ahead of time, just so we can navigate the tech side. So Kalia, if you've got yours, otherwise I've got it for you. She's one of our middle grade students.
Hi, I had a question already. Yes, my questions are already said, so yeah.
Kalia, give yourself credit. The one I've got for you was, what would your plan be if you were able to run or take over and make changes to a country that's highly affected? So that sounds like a loaded question, but it sounds very appropriate.
Yeah, that's a question. Sorry. Yeah, that's a question.
Kirsty, do you want to go with that one?
That's a big question, isn't it? Yeah. I think that just making sure that everyone's working together and that it's led by the science and the scientists. If it's a bit of a loaded question, if it relates to the US, then you have some incredible, the world leading scientists. So I know you can do it. Just getting everyone together, letting the scientists lead, getting testing available to everyone, making sure you've got good contact tracing systems, and being willing to learn from everywhere else. Some of the poorest countries in the world are doing the best. So it's about us being humble and ready to learn.
Yeah, I think that's a really good point, Kirsty, in the sense that this is not like who's going to get there first and who's the best country in the world, because we're, New Zealand, while we're getting some kind of recognition for what we've done, this is not some, global league table of the best country in the world. We just happen to have cracked this for the moment. So I think in terms of what other countries can learn, I totally agree with Kirsty. Carla, I think it's about having really good leadership that people trust. And it's really hard to get universal trust into one person or a group of people. But oh boy, we can do a whole lot better in some places around building trust, and being credible and honest, and realistic, and communicating really clearly with your population, with the people who have voted you in, and those who didn't, but who are now being led by you and your team. So again, pretty simple stuff, I have to say, but really the tough work when you go to do anything at a national or country level or at a global level, the sciences seems like the really difficult, the stuff that's going on in the labs, that's complicated, that's got its own, but the really tricky stuff is dealing with people, is actually getting people to work together and think collectively for a good beyond their own personal needs, for a collective good. That's the things that will trip leaders up and over history and going forward. We're really smart in the labs. We're really good with technology. We're really good about thinking about systems. As human beings, we can be so tricky and we can be so difficult with each other and so driven by personal or other needs. So, that's going to be some of the big challenges you'll face in your jobs in the future. Isn't just the intricate mechanics of the job you do. It's getting people to work together and as Kirsty said right from the beginning, be kind, because fundamentally that's what it comes down to. So
yeah, I would just say plan for looking after your most vulnerable. Think about what their experience is like and imagine that to be the majority experience and work from there. And I think at a fundamental level, that was the decision that the Prime Minister made here right from the start, is that we have vulnerable populations and it is just not acceptable to let them be ravaged by this illness.
Thank you then.
All right, thank you, Kalia, for that. Our next question is Oliver. He's one of our younger students. All right, Oliver.
Hello, thank you so much for doing this. So my name is Oliver, I'm in 4th grade. My question is, what do you think about testing for the coronavirus worldwide and the amount of tests and how accurate they are? Do you think we will ever have an easier way of testing, like at home?
I don't know if you've got anything to say on that, Jude. Thank you, Oliver. I am not a testing expert, so I don't know. I think it's highly likely the tests will get better. I think it's highly likely. We're still learning about the disease and the tests are not amazingly accurate in terms of they could be better. I think it's highly likely. I don't know what you think, Jude.
I think, like all things, Oliver, we get smarter and we refine things as we go forward. So this is a novel coronavirus. The normal kind of methods of testing, or, you know, we've had to adapt a method that can be done to a lot of people fairly simply with quick turnaround of results. As Kirsty said, who's just had the test, you know, like results could be swifter, because the sooner you know you've got, you're positive for coronavirus, COVID-19, the more quickly you can respond. But I think I'm optimistic that I think testing will get quicker. We know how quick we can do all sorts of other tests that used to take so long before in the past. I mean, you can walk in, Oliver, into a chemist and get tested for diabetes instantly. You can get all sorts of things really, really quickly now. So I'm really optimistic that people are working really hard, because we want things to be cheap, because if they're cheap, then most people can get them. And if they're cheap, they're typically simple, sort of, and we want them accurate. We want to make sure the results are correct. Most of the time, you'll never get 100%, but sort of as high up to as 99% as possible. And we want them available to everyone, and for people to not feel scared about having a test. So that's really important. The test has to be safe, has to be accurate, has to be really easy to access, and it has to be fast. And ideally, if you could do it at home, that's awesome. That would be great. That's where we're all working. I mean, there's a whole, you know, laboratories of scientists beavering away at the moment doing that, because the person or the people or the group who comes up with that quick test that's accurate, well, the one that, you know, they want to get ahead of that. So I'm really optimistic about that, Oliver. I think that'll be coming out fairly shortly over the next year or so. Yeah, within.
Thank you.
Dr. Wanda, Dr. McCool, my goodness, our hour as we've done it. It is now 5 o'clock here in America. That's woo, and end of a full day. You've been incredibly generous with all of us, and meeting us and spending time with us and arranging for this to happen, and beginning your Friday. We're excited about it being tomorrow, Friday, and just wanted to make sure you know how grateful we are. And so, kids and teachers, if you're okay with turning on your video and extending your thanks to them, we will end our session today. And we look forward to staying in touch with you if you'll be up for that. I do know some people who are, you know, incredibly interested in the work you're doing, and I might email connect you all. And we do have to throw in when things get better, we're coming to New Zealand, and
Absolutely.
a Lord of the Rings tour, because that's what everything's all about. And we'll have a great time.
I thought, how long until someone brings up Lord of the Rings? Please don't ask me about it, because I haven't even seen it. But
oh my goodness!
Oh, I know. Can I thank you, everyone, for just the opportunity to see you all today, to talk to you for your great questions. And I know it's a tough time, and you're definitely in our prayers, and there is definitely hope. It is a really rough time, and I know people have lost people, but yeah, better days are definitely coming. Yeah, we'll get through this together. So thank you for this opportunity to chat.
Yeah, thank you from me too. Thanks, Jason, for organising this. This was worked perfectly well. It's totally doable, and we'll keep in touch.
Lovely. All right, everybody. Thank you both. We're so grateful.
Thank you.
That was awesome. Thank you.
Bye.
Thank you.
Thank you.